It's not just the odd empty bed in this West Yorkshire care home, it's a whole floor, 14 empty bedrooms. Yet at the same time, an average of 13,000 patients every day are in a hospital bed in England when they could be discharged. But lack of funding in the care sector means lack of staff, and that means they can't take those hospital patients.
The difficulty of reopening those floors is around sustained funding from the local authority. If they're not paying enough beds, enough money for the bed, and there's no guarantee that that bed will actually be filled, then it's the difficulty of recruiting staff. Funding is considerably less than it should be, about 25% less than what the market is saying it needs to survive.
There are currently 165,000 vacancies in England's care sector. And after a weekend which saw NHS crisis talks at Downing Street today, it was announced £200 million would be provided to help with discharge, including block booking, local authority beds and residential homes.
Capacity on wards will be freed up, which in turn enables those patients admitted by emergency departments to move to wards, which in turn unblocks ambulance delays.
A further 50 million will go towards upgrading hospitals for better patient flow. None of the combined 250 million, though, is new money. And there was a question of why now and why not before winter had begun.
What has been announced today is yet another sticking plaster when the NHS needs fundamental reform. The front door to the NHS is blocked, the exit door is blocked, and there simply aren't enough staff.
This is not just an England problem, it's across the UK. And in Scotland today, the First Minister also said the hospitals were almost full.
Last Wednesday, hospital bed occupancy across Scotland exceeded 95%. Now, for context, at the same stage in 2020, before the pandemic struck, occupancy was around 87%.
And she said there would be more money for discharging patients. Flu, COVID and Strep A have added to the pressure on a system already overstretched, a winter crisis that has become year-round. The Department of Health and Social Care, they are having to put out a number of different fires. There's the strike, the dispute with the health unions, and that does not seem to have been resolved today. And then, of course, there is the winter crisis. And although there is the promise of more money going into the health service and social care, that is not going to have an immediate impact. And today, an hour-long meeting between health unions and the health secretary failed to avert further strikes.
All that the government are interested in is saying that in order to justify a payment, then we need to come up with productivity savings in the NHS. That is absolutely ludicrous. This isn't a factory we're talking about. We are talking about people who are working well beyond their contracted hours anyway.
How did the meeting go?
So it was very civil, it was productive. It was progress in the fact that we were in a room with the Secretary of State talking about pay. We didn't get the firm commitment that to talk about, make an offer on pay that will enable us to resolve the dispute. There was no discussion of a one-off sum that's been talked about in the media today. There was no commitment to a figure or to boosting pay.
Save NHS! When do we want it? Now!
So this month will look like last month unless negotiations are opened. This Wednesday we'll see paramedics on the picket line again, nurses will go out next week and another ambulance strike the following week. While the British Medical Association Junior Doctors ballot opened today, raising the spectre of a 72-hour walkout in March.
Victoria MacDonald there. Well, health service workers in Wales will be offered a one-off payment, which the First Minister, Mark Drakeford, said would be the basis for discussions with unions. Let's get more now from our Home Affairs correspondent, Andy Davis in Cardiff. What more can you tell us, Andy?
Mark Drakeford said that if there had been speculation today about a one-off payment for nurses in England, it was entirely coincidental that he was proposing something similar here in Wales. The Welsh Government wrote to health unions on Friday, inviting them to talks. And among the discussion points, the First Minister said today, would be this matter of a one-off pay offer, in effect a bonus, not a bigger pay rise. Exactly how much he wouldn't say in advance of a meeting with the unions. I did ask him in the press conference if he thought that NHS workers in Wales deserved a bigger pay award, and he said yes they do, but he repeated the claim that the Welsh Government wasn't able to do that without extra funding from Westminster. So this was the best they could offer, a one-off payment which would be funded by moving money around within the existing Welsh Government budget for the current financial year.
It has required an enormous amount of work involving, in the end, every single one of my ministerial colleagues to look at plans that we have for the final quarter of this year and to amend those plans to release a sum of money that we can put on the table, which we can then talk to our trade union colleagues about how that sum of money could best be distributed amongst their members.
So, Andy, when are those talks happening?
It looks like it's going to happen on Thursday, where the overall sum of money, no doubt, will be disclosed. Not an insignificant amount, said the Welsh Health Minister today. Unison Cymru said it welcomed the reopening of talks with the Welsh Government, but it was unlikely to halt future industrial action. And it doesn't look like it's going to stop the ambulance workers' strike in Wales on Wednesday, the day before this meeting. That's according to the GMB union, one of those involved. And their broader point, echoing that of the Royal College of Nursing, is that it's improved pay rises, year-on-year pay rises, not one-off payments, which are central to their demands. Meanwhile, the pressures within the NHS remain unrelenting. And today, Mark Drakeford said that the 27th of December had probably been the busiest day the Welsh NHS has ever experienced in the whole of its more than 70-year history.
Andy, thanks very much. Krishnam.
Thanks, Jackie. Well, the chair of the Health Select Committee, Conservative MP Steve Bryan, joins me now from the central lobby of the Houses of Parliament. Before Christmas, I think you suggested the government ask the pay review body to go back and think again about the nurses. Do you think that's still the best route to resolving this, or does it now look like ministers are just going to bundle up 2 years of pay deals in one and short-circuit the whole thing?
It does look like that. I mean, to be clear, I asked the pay review bodies to look again, which of course they will, and they received the remit letters from the Secretary of State in England and opposite number in Northern Ireland and Wales before Christmas. I have to say, you know, I think the government is right to believe in the independent pay review process. If I was giving the unions or even the opposition advice, dare I do such a thing, I would suggest they should be talking up the independent pay review process, inputting into it, and making sure that it comes up with something robust and with some hope for the future for next year's from 1st of April pay deal. Let's remember the current pay deal has got less than 3 months to run.
Yeah, and it hasn't been resolved yet. I mean, they also say that it's not independent as a pay review body because the parameters are defined by the government, and those parameters are out of date when it comes to inflation. So, you know, there's a good argument to go back. But the point is time's running out, as you say. Yeah, don't we need to do something quick?
The alternative is that ministers negotiate pay directly. So we're back to beer and sandwiches. You know, we've seen what's happened when Scottish ministers have tried to do that with the RCN. They gave them quite an improved offer. They rejected it out of hand. So, you know, I do think that's where madness lies. I do think an independent pay review process. Now, it's taken a bit of a hit in recent weeks, let's face it, because it has been trashed left, right and centre. And we're hoping to talk to the NHS pay review body in the Select Committee later on this month, because I think it's it's clearly a very important public body that's performing a very important service, and yet it's actually cloaked in a lot of secrecy. So I'd quite like to draw back the covers on that and give the public, your viewers, some insight into it.
Now, on the actual winter crisis measures that were announced today, which is buying up care home beds for people who, those people really want, a lot of them want to go home and have care at home.
Yes.
You know, and now you've got the Health Secretary forcing them into a home.
Yes, and if you look back at what I said in the House today, I made the point that, yes, social care is sometimes about care in care homes, but actually the vast majority of social care is domiciliary care. A county council in England told me last week they've seen a 30% increase in the past year in demand for domiciliary care. Now, that is huge. So I did ask the Secretary of State today to make sure that he doesn't forget domiciliary care in this, because you're absolutely right. People do want to go home. They want to have the choice, and that was a point made by a number of people in the House today. So, no, absolutely.
Are you not appalled, though, that it's January and that this is being suggested? I mean, this crisis was predicted for months and months, all the way through last year.
OK, so no, I'm not appalled. The demand was the government get in the room and talk to the unions. Well, they've started to do that today. I think that's positive. There's been a definite change of tone. The unison response was very positive. Interesting, the Unite response from the chap who wasn't even in the room, but hey, let's move on from that. Then the other request was that there is some action. There is new investment and there's some action. That's what the Health Secretary in England has announced today. But I say in England because you just had this in your package. The NHS in Scotland is under increasing pressure. Nicola Sturgeon says the greatest that she can remember. The same in Wales. We're seeing the same across Europe in many health systems. This is not an English problem. Yeah. So I realise that some politicians and maybe even some media want to make this an English Tory problem. It's not. I'm not appalled, but I'm pleased to see that £250 million of investment has been announced today. But as I said in the Commons, I want to know what dials the Health Secretary in England is watching to make sure that money is spent well and wisely.
How many of your colleagues agree with Edward Lee that the government doesn't have a plan? It's only Labour that's got a plan. He clearly wants, something very radical to be done with the NHS, a totally different way of thinking.
Yeah, to be fair to Edward Lee, he has been consistent in his view. Not many of my colleagues, in fact, a vanishingly small number of my colleagues agree with him. Does the NHS need reform? 100% yes, it does. And I think you'll find me and the Shadow Health Secretary, who I think you're speaking to next, are on the same page there.
All right, Steve Bryan, very interesting. Thank you very much indeed. Well, the Shadow Health Secretary, Labour's Wes Streeting, joins us now. Let's begin again on the strikes. Do you think the government should now get in the negotiating room and start making concrete offers, what Steve Bryan referred to as the old beer and sandwiches with the unions?
They do need to negotiate. In fact, if they'd done that before Christmas, the nursing unions were very clear they would have called off the strikes and sat down and negotiate. And the reason we're in this position is because it's ministers, it's the government that sets the parameters for the independent pay review body, that sets the parameters of their decision-making, which is why we ended up with a deal, let's not forget, that was decided months and months ago, long before Liz Truss and Kwasi Kwarteng crashed the economy with their mini-budget.
But once you break
we can
the
see
process,
we are where we are.
I mean, once you break the process of a pay review body, then why ever go back to it?
Well, I think the unions make reasonable case that certainly I'm open to, that the pay review body are important, they're independent, we should stick to that. But we might need to change the way that they operate to rebuild confidence that I think has been lost. And I think Steve Bryan is right about the loss of confidence in the independent pay review body process. We want to see that back. But right now, we need to avert strike action in the NHS. It's strike action that patients can't afford. The NHS is not just on its knees, it's on its face. And it's also strike action that nurses and paramedics can't afford, because every time they go on strike, they lose a day's pay. And this is in a climate where hospitals are opening up NHS food banks for their own staff. That's how bad things are. And so for them to go on strike, and bear in mind, nurses have never had a national nursing strike in this country. For them to go on strike is a sign of desperation, a cry for help. And the government's been too slow in answering that call, and that's been a fundamental, terrible error of judgment.
On today's measures, £50 million for hospital improvements. I'm sure you welcome that. The £200 million to buy care home beds. Is it the right thing to be doing, to moving some people from hospital into care homes?
It's a sticking plaster. I'm not convinced it's going to work because, let's be honest, the social care sector is not awash with capacity because they're really struggling on staff. We've got about 160,000 vacancies in social care, people leaving the profession because other employers are paying more than the derisory pay that many of our care workers get. But I don't think it's the right answer, Christian. Going back to a question you put to Steve Bryan earlier, we do need more care in the home. That's why one of the reasons why part of Labour's workforce
pledge, and our plan for beyond the next general election is to double the number of district nurses qualifying, because I've seen firsthand, shadowing district nurses at work, the valuable role they do in not just caring for people in their home, but preventing them from becoming ill. So by having more care in the community, yes, we can speed up delayed discharges and free up bed space, get more patients flying through the hospital, but we can also prevent people from ending up in A&E in the first place. And we've had now 13 years of promises and broken promises on social care and the NHS, and look where it's got us. No wonder we've got Conservative MPs like Edward Leese literally standing up in the House of Commons this afternoon and saying Labour has a plan. Where's the Conservatives' plan? And this is the Conservative Party saying this.
One of your plans is to sort of tear up the way GPs work in this country. You're talking about maybe salarying them, ending the idea of GP practices where they are partners, and changing the way all of those health centres work. Is there not a risk that you need them more than they need you and the National Health Service? If you alienate the doctors too much, they can always just go off into private medicine.
Well, we're going to consult on, because we need to fix the front door to the NHS. It's broken. I think back in October, the latest data, 2 million people waited more than a month to see a GP. And why are we surprised? The Conservatives have cut about 5,000 GPs in the last decade. So it's a no-brainer, isn't it? Fewer GPs, longer waits. Labour's plan is actually to recruit more GPs. I think I'm open to asking a question of the profession and of patients. Since the NHS was created, GPs have operated as independent businesses. The trend is changing. By 2026, a majority of GPs will be salaried. They will no longer be what's known as GP partners, where they effectively run their own small businesses. And I'm asking in a genuinely open way, actually. It's a genuine question and genuine consultation. I know that's sometimes a novelty in politics, but it's a genuine consultation. Is there a way of fixing the front door to the NHS? Is that the right way to go? It's part of a wider package to fix that front door, get people seen faster, and deal with the terrible situation we see in our hospitals.
Wes Streeting, thank you very much.